Ladies and gentlemen, please accept my sincerest apologies for not being able to be with you today. I was really excited when I received the invitation to join the panel Ending Preventable Stillbirths, Identify, Prevent, Treat and Care, because as a mother, I felt it would be very important to share my own story of a stillbirth and the way that we can prevent this going forward. As Save the Children National Newborn Champion for Nigeria, ending preventable stillbirths is important to me. Globally, there are 2.6 million stillbirths each year, with nearly half occurring during labour. Yet these are invisible deaths, as they are not included in global tracking efforts for newborn and child mortality. Even now, SDG 3 does not include a specific target for ending preventable stillbirths, with SDG 3.2 calling for the end of preventable deaths of newborns and under 5 children in live births. We cannot end preventable stillbirths unless we begin to identify and track them. By treating stillbirths with the same focus, we can bring solace to parents who experience the pain of an invisible death. As a mother who suffered the tragic loss of one of my own twin babies during childbirth, I believe that raising the voice of parents and communities is crucial to achieving this survival. The relationship between parents and their midwife is vital to raising the voice of parents. Unfortunately, many parents do not receive comprehensive counselling about the reasons behind the stillbirth, the potential for it to recur, and how to prevent it in a subsequent pregnancy. As the Global Goodwill Ambassador for the International Confederation of Midwives, I believe that a skilled midwife acts as an advocate for parents and the community that he or she serves. By providing antenatal care, midwives can identify risk factors, refer women for obstetric care, and prevent stillbirths, thus ensuring the survival of mothers and their babies. Antenatal care offers an opportunity for risk assessment, screening, and a safe space for parents to develop a birth plan that both prepares parents and ensures that their wishes are adhered to during childbirth, setting the course for respectful maternity care and more positive health outcomes. The Wellbeing Foundation Africa has introduced antenatal education programs that can be delivered by midwives to all parents. A woman's need for information and her willingness to make lifestyle changes is highest during pregnancy. Thus, antenatal programs that take into the account the community context, including language, culture, and religion, empower parents and enable them to have an active voice in their own healthcare. Raising the voice of communities is important too, as community-led solutions are often the most effective and the most sustainable. The Wellbeing Foundation Africa found this to be the case when we instituted a community-based health insurance scheme called the Alafia Universal Health Coverage Fund, AUHCF. This is a global best practice model that funds the insurance premiums for 5,000 Nigerian citizens a year. Healthcare costs can cripple parents financially for years, resulting in further economic vulnerability and limited access to primary healthcare, setting off a cycle of poverty and poor health for generations. Equitable access to healthcare services for communities as a whole impacts overall health habits, encourages healthier home practices, and improves community-based care, helping to bring an end to preventable stillbirths. Bereavement is extremely traumatic. Stillbirths are not invisible deaths when they impact parents and communities so deeply. To a mother and to a father, a stillbirth is no less a tragedy than the death of a newborn baby or a child. Unfortunately, many parents do not receive comprehensive counselling about the reasons behind the stillbirth, the potential for it to recur, and how to prevent it in a subsequent pregnancy. Support and information for families is therefore paramount and should be readily available. Ending preventable stillbirths in our time is a moral imperative, and we must work together to identify, prevent, treat, and care for the families and communities that suffer these tragedies. Through advocacy, through better training, through antenatal education, through capacity building to strengthen health systems, and through strategic partnerships, we can instigate stillbirth health intervention within national RMNCH programs.